Well, let's catch up with the latest developments on the pandemic and the vaccine rollout now with Professor Peter Collignon, who joins us again. Good to talk to you, Peter. We've got this kerfuffle now about GPs, and some of them suggesting they're not being paid enough. It's too difficult for them to be involved in the vaccine rollout. It seems an unusual complication, because I would have thought most GPs would be willing, ready and able to deliver this vaccine, especially to their elderly patients.
Well, I would think the same. The reality is there's going to be a shortage of vaccine for a while. So if some GPs don't want to participate, I guess that'll disadvantage their patients. But, that won't stop the vaccine going out in a timely fashion. I won't get into how much people are paid and everything else, other than I understand it's still twice the payment of what you get for flu vaccine, for instance, which seems to be given out. And the other issue is this is a different vaccine. First of all, there's a shortage of supply. Secondly, it's in multi-dose vials, which means you've got to do the training because there's a cross-infection risk. So, but also you can waste it, both by, in fact, as happened already, people give too big doses because they don't realise it's multi-dose vials. But also, if you don't have the right number of people turning up, whether it's an eight-dose vial or a 10-dose vial, you've got to have the right amount of people there at the right time within a day, because otherwise you waste a lot of the vaccine. And that's an issue when it's in short supply. So I think there is an issue about doing this properly, doing the training. And I think the government has been reasonably generous in the payments they're giving. And in the short term, I think we just, do it where people are willing to do it. And, the vast majority are more than, willing. I would think a GP will use them. This may be an issue in the future in 6 months' time when there's not a shortage of vaccine. But for the moment, I think we just take on people who are willing to do it under the current conditions. Yeah,
that context explains why it might be a bit difficult for a lot of practices. They might not need to organise effectively times when they're doing the vaccinations rather than just drop them into normal consultations. I'm wondering also, is this only for the AstraZeneca vaccine? Because I would have thought with the Pfizer vaccine and the freezing and temperature requirements, that might be very difficult to organise in small batches.
Well, the Pfizer vaccine is more difficult because it currently has a -70 transport chain. Once it's, if you like, thawed, it can be kept at fridge temperature probably for a day or two. But it's the same issue. It's either 5 doses or 6 doses from a vial, depending whether you can get the special syringes so that with less dead space to give the 6 doses. So all of these vaccines, at least in the short term, meaning the next 6 to 12 months, are going to be multi-dose vials. And that means it's very important, while there's a shortage of vaccines, that you have exactly the right number of people turning up at a prearranged time so you don't waste it, and also you do the training so, in fact, you don't cause problems with it.
So it makes sense for people, if they're vulnerable or elderly, or vulnerable in other ways, just to let their GP know that they're interested in the vaccine, and hopefully they can make sure they get access as early as possible. The other thing I wanted to get your thoughts on, Peter, we've talked a lot before about the various strains. It seems every few weeks we read about another strain and it's more infectious, and there are greater concerns about that. Hasn't played out that way, thankfully, in Australia so far. But when it comes to vaccines, do we have much evidence about whether they work against all strains, or could that be an issue for us?
Well, it might be an issue in the future, but currently so far, it would appear all the vaccines we have that are out in the field, at least for serious disease, getting into hospital death, all appear to be working as well against all the strains. Now, there may be arguments, there's a South African strain, there was a small study that showed it didn't stop mild disease in healthcare workers as well, but it was a small study and we really don't have the data. A large degree, all these strains, it's interesting, when I was looking up about the Russian strain and looking up in news reports, the Russian health minister was really worried about new strains coming into the country, but that was the UK strain. So there's a fair bit of xenophobia here almost. Whatever strain is developing somewhere else must be really bad, we can't let it in. Now, all the available evidence is all these strains still transmit the same way, mainly by droplets in people in close proximity. You get it in your eyes, your mouth, your nose, and that's how you get infected. Some of them are a bit more infectious, but basically, if we keep on doing the things we've done, we seem to be able to control it. And if you look at all the issues in Australia about Russian strains and UK strains, where we've done the right things, it hasn't transmitted. So, I think we've got to be a little bit careful about this. Strains may well become more infectious as time, but so far there's no evidence that that's markedly different. 3 US strains are much worse than 1.5 UK strains, for instance, or 1 UK strain. So we need to be careful, keep on doing the things we know work, not lose our cool, particularly because we've done so well, but we've got to do the basics and continue to do the basics and not get too hung up about Russian, South African, Brazilian or whatever strain appears next week.
Peter, thanks for joining us again.
Thank you.
Peter Collignon there from the ANU, always all over this stuff. Really wise words there. Sure, we've got to get out there, get the vaccine, get it certainly as soon as you can us here in the vulnerable categories. But remember how well we're doing here and how those basics, the basic social distancing and hygiene, are what protect you from infection. And also, pat yourself on the back because we just haven't had much community transmission in this country at all this year.